Good day, everyone. Today we will talk all about integumentary system. So what is integumentary system? The integumentary system consists of the skin as well as hair, nails, and glands. It acts as a protective barrier that separates and protects us from the external environment. Aside from protection, it also helps us feel things, control body temperature, produce vitamin D when we're exposed in the sunlight, and remove small waste. In integumentary system, we have 5 major functions. First is protection. Protection is act as a barrier against UV rays, microorganism, and water loss. For example, is when you get a small cut, your skin help stop the germ from getting inside in your body. The second one is sensation. Sensation contains receptor for heat, cold, touch, pressure, and pain. And for the example of this is when you feel pain when you touch something sharp. And the third one is temperature regulation. Temperature regulation regulates body temperature through blood flow and sweating. For the fourth one is vitamin D production. Vitamin D production is produce vitamin D when exposed to sunlight. Last one is exudation. Release a small amount of waste through sweat and glands. Example of this is like yung nagja-jogging kayo tapos like pagpapawisan na. That is exhalation. And we have 2 major tissue layer. What is epidermis? Epidermis is the outer layer of our skin. It is made of many layers of flat cell and has no blood vessel. That means it can get nutrients or remove waste on its own. Epidermis have several types. First is keratosis. Keratosis is the cell make keratin to protect our skin. Keratin is a strong protein found in our skin. So the example of this is like when you get a small scratch, keratins help keep your skin strong and safe. And we have here melanosis. Melanosis is the cell make melanin which give our skin color. For example, as when you go out in the sun, your skin get darker because of melanosis, make more melanin. And another one is Langerhans cells. Langerhans cells is help the germ that enter through our skin. Example is if you have a bacteria and get it inside your wound, this help protect you from infection. And the last one is Merkel cells. Merkel cells help us feel light touch. For example, when a feather touch your skin, Merkel cells help you feel it. And we have here keratinization process. This is the process when the skin grow, move up to the top layer of the skin, fill the keratin, and then die. These dead cells form a tough layer that protects our skin. For example, when your skin peels after a sunburn, dead skin coming off, and those are cells went through keratinization process to protect you.
We're going to take a little lesson from Miss Janine. We're going to discuss about the epidermis. I want to mention about keratinocytes. They are cells found everywhere in the epidermis. They are cells that make keratin, and keratin makes our skin tough and water resistant. Keratinocytes are produced at the bottom layer of the epidermis. As you can see here, the bottom layer of the epidermis is the stratum basale. Keratinocytes gets pushed upwards to the top superficial layer of the epidermis, where they are considered cornified. Cornified cells are hardened, flattened, tough, and are considered dead. They have lost their organelles and they're just full of keratin. And now I'm gonna discuss that in the next slides. The stratum basale. The stratum basale consists of one layer of cells called basal cells. This is where the cells constantly do mitosis. Next is the stratum spinosum. The stratum spinosum's job is to consume bacteria, so they basically act as a macrophage. Next is the stratum granulosum. So in here, in this area, in this layer of the epidermis, keratinocytes has been pushed upward and they're flattened. This layer contains granules, and keratinocytes has lost their organelles in this layer. Next is the stratum lucidum. This layer is only for the thick skin areas. This layer consists of cornified cells. They contain the type of protein that gives them the transparent appearance, as you can see in the slide before. And lastly is the stratum corneum. The stratum corneum consists of cornified cells continuously shedding off and replaced by replacement cells coming from the layers before it. So as you can see, the stratum corneum is the most superficial layer of our skin. So basically, it's the top part of our skin. Following it is the stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale. So thick and thin skin differs because thick skin are found in the palm, soles, and fingertips of our body. It has all 5 strata, including the stratum lucidum, which I discussed a while ago. Stratum lucidum are only found in thick skin. In thick skin, the stratum corneum is very thick. Thick skin also lacks hair follicles, and thick skin adapts to the high pressure friction areas. Thin skin cover most of our body, like our forearms, for example. It lacks stratum lucidum and is thinner in all strata. Thin skin has hair follicles and it's more flexible than thick skin. Have you ever noticed a thick skin that grows after you go to the gym and all you use are metal barbells? That's called a callus. Callus are formed if the basale is trying to respond from frequent abrasion or friction by making more cells, which result in the thick stratum corneum.
So, skin color. Skin color has 3 factors that determine skin color. These are pigments, blood, and skin thickness. First is pigment, also called as melanin. It gives color to our skin. More melanin means darker skin, like us Filipinos. Second is blood. If blood flow is strong, the skin looks pink or red. But if it's low, the skin or lips looks pale. Last is skin thickness. Thin skin looks lighter. That's why our palms looks lighter than other parts of the body. So what is melanin? Melanin is the pigment responsible for skin, hair, and eye color because it is the main pigment that decides how light or dark our skin is. Melanin also protects the skin from harmful UV rays. It absorbs sunlight, helping prevent skin damage from the sun. So let us identify the regions that has large and less amounts of melanin. So for the region with large amount of melanin are freckles, moles, nipples, areolae of the breast, axillae or armpits, and genitalia. For the region with less amounts of melanin, these are lips, palms of the hand, soles of the feet. Melanin production. So melanin are made by melanocytes in the lower skin layers. Then, melanocytes produce melanosomes. These are melanin-filled sacs. Then melanosomes are passed to keratinocytes. These are the main skin cells. Then the enzyme tyrosinase converts tyrosine to dopaminan, which become pigment. So, how does it work? So, proceeding to the next slide, this is how it works. So, number 1, melanosomes are produced by the Golgi apparatus of the melanocytes. So, ang ingon sa number 1 is, ang Golgi apparatus of the melanocytes kinag-produce siya og melanosomes. So, mauni siya ang Golgi apparatus, kaning green, tapos kaning circle nga mga red, kay mao na siya ang giproduce sa Golgi apparatus which is ang melanosomes. Then, number 2, melanosomes move into melanocyte cell process. So, unsay ginamin sa number 2? Ang number 2 is marag padung siya sa keratinocytes. Padung pa lang jud ni. As you can see, kani tip mao pa lang ni ang number 2. Kani mao pa lang ni number 2. Mao pa lang ni number 2. Tapos number 3, epithelial cells phagocytize the tip of the melanocyte cell process. So, kani naman is maano ni siya ay kanang di ba ganina is pointy marag padung pa lang siya sa keratinocytes. Ang number 3 naman is like ningsud na siya sa keratinocytes pero di pa jud siya totally nga naa sa sulod. Then number 4, the melanosomes which were produced inside the melanocytes have been transferred to epithelial cells and are now inside of them. So, kung ang kaganina, nag-ingon ko nga ang melanosomes is ningsud pa lang sa keratinocyte pero di pa jud siya totally nga nasa sulod. Pero ang kaning number 4 is naa na jud ang melanosomes sa sulod sa keratinocytes. So, proceeding to melanin production is determined by, or we can call it, what affects melanin production. So, number 1 is genetic factor. So, primarily responsible for skin color variation. Yes, that is correct. Because your genes control how much melanin your body makes. And for number 2 is exposure to light. So, when skin is exposed to sunlight, it makes more melanin to protect itself. So, number 3, hormones. So, whenever you have hormonal change, like during pregnancy, it can darken some areas of your skin. Although many genes are responsible for skin color, a single mutation can prevent the manufacture of melanin. Examples are albinism. Albinism is a genetic condition where the body cannot produce melanin due to the absence of the enzyme tyrosinase, resulting in very light or no pigment in the skin, hair, and eyes. Also, carotene. Carotene is a yellow pigment found in certain plants like carrots and corns. When consumed in large amount, it can cause the skin to have a yellowish tint.
Let's talk about skin cancer, its causes and risk factors. Skin cancer is the most common type of cancer. Most cases result from UV radiation and sunlight, which damages DNA and epidermal cells, causing mutations. If not repaired, these mutations can affect genes that regulate the cell cycle, leading to uncontrolled cell division. Other contributing factors include chemicals, X-rays, inflammation, suppressed immune system, and genetic inheritance. The groups with a higher risk in these cancers are individuals over 50 years old, people with repeated sun exposure, people with a history of sunburn, and those who work or play under strong sunlight. Most of these skin cancers occur on the face, neck, ear, and dorsum of forearm and hand. And as what I've mentioned earlier, skin cancer is the most common forms of cancer, especially in the US. In 2021, doctors diagnosed more than 207,000 new cases of melanoma. Another study found that 1 in 5 Americans developed a non-melanoma skin cancer by the age of 70. However, skin cancer in the Philippines is relatively uncommon, making up about 1% of all cancers. The most common types are basal cell and squamous cell carcinoma, often found on sun-exposed areas like the head and neck. Most patients are around 60 years old with slightly more women affected. Late diagnosis is common due to limited access to dermatology services, especially in rural areas. And these cancers could look like a mole, a pimple that doesn't heal, or a patch of rough skin. One sign of skin cancer is a new spot or growth that suddenly appears, or a mole that changes size, color, or shape over time. There are 3 main types of skin cancers: basal cell carcinoma, squamous cell carcinoma, and melanoma. But first, what is basal cell carcinoma? This is the most common type of skin cancer, and it affects the stratum basalis cells. This looks different depending on where it develops. On the face, ears, or neck, this appears as a small and smooth bump with a pearly or waxy feel, and it may also bleed on its own. On the arms, leg, and torso, this appears like a flat spot that's pink, red, or brown. Sometimes it could be rough or crusty. Basal cell carcinoma grows slowly and rarely spreads, and it's highly treatable with early detection through surgery or topical treatments. Squamous cell carcinoma. This is the second most common type of skin cancer that arises from the squamous cells in the outer layer of the skin, and it affects the cells in the stratum spinosum. This can resemble a firm red nodule, may also be a rough and scaly flat lesion. This might hurt or bleed or become crusty. Also, the squamous cell carcinoma can grow and spread if not treated promptly. Melanoma, or as what others call black tumor. This only accounts for 1% of skin cancers. However, this is one of the deadliest forms of skin cancer because it grows very fast and can metastasize to the lymph nodes and internal organs. This often looks like a brown patch or a bump with an irregular shape or color. About 1/3 of melanoma develops from a normal mole. However, most of it grows out of a normal skin. Luckily, this is highly treatable when caught early, with a 99% cure rate. Early detection is the key to determine the best treatment plan. That's why experts recommend the ABCDE rule to identify melanoma: asymmetry, border, color, diameter, and evolving. So for asymmetry, assuming this is our mole, our normal mole, kaniya circle here. Halimbawa, circle ni siya, no? And then, if I were to cut this in half, cut na to siya in half, dapat both sides should look identical. However, if the sides don't match, halimbawa, ang kaninga side kay ana na siya og naong, meaning, dili na siya symmetrical sa pika side. And that could be a sign of a problem. B. Border. So, ang ato ang normal moles looks like this, kaniya circle. Ana siya. Ang normal nato nga mole, ang iyahang border is smooth and consistent. Ana ra jud na siya. But if ang border nato mahimong jagged, mahimong ani ug naong, or kabantay mo anang kanang splat sa paint na more siya ana. that could be a warning sign. So, color. Color for melanoma is inconsistent. So, if makabantay gani ka na ang imuhang mole dati brown, nahimo siyang pink karon or nahimo siyang red karon, or halo siya na colors like na red, na brown, na pink, na gray, na white, that is a warning sign na po. That could be a problem. Kay, if kung unsa gani ang color sa imuhang mole pag appear niya sa imuhang skin, it should be consistent. Ana ra jud iyang color by the end of time. D. Diameter. Larger skin spots are a sign of skin cancer. So, a spot or a mole should not be bigger than a pencil eraser or 6 millimeters. So, for example, mauni ang ato ang normal mole or normal spot sa skin. If mudako gani na siya, suddenly, labi mas dako siya sa kanang lubot bitaw sa lapis, kanang pencil eraser, if mas dako siya ana, you have to be worried na. Because if mas dako na sa 6 millimeter, that is a problem na jud. And in most cases, pag inana na gani siya kadako, you should check in with your doctor na jud. And lastly, E. Evolving. Normal moles maintain steady appearance. So, para sa akong giingon na, if kung unsa gani iyahang naong pag-appear sa imong skin, ana ra jud na siya, dili na siya mo change. So, if kana siya nga mole, mabantayan nimo mo change in size, mo change in shape, mo change in border, elevation or color, and labi na if mudugo, mahimong crusty, itchy, or mahimong mushy, that could be melanoma na. Doctors also identify skin cancers with the ugly duckling rule. Looking at this illustration here, there are 7 moles. You'll notice that one of them stands out. It doesn't look like the others in terms of shape, color, or size. This is exactly what the ugly duckling rule refers to. It's a visual way to spot a potentially dangerous mole by comparing it to the rest. Most people's moles look quite similar, so when one looks noticeably different, it might be a warning sign of melanoma. That ugly duckling mole is worth getting checked by a medical professional. Oh, but wait, I want you to take note that some melanomas don't fit the ABCDE rule or the ugly duckling rule. So, if you have sores that won't go away, unusual bumps or lesions, changes to your skin, or existing moles, you should immediately check in with your doctor. In this discussion, we're gonna take a closer look at the dermis, which is right below the epidermis and is superficial to the hypodermis. So the dermis has 2 regions. The very top part of the dermis is called the papillary layer. Below that, majority of the dermis is called the reticular layer. But first, we're going to talk about the papillary layer. You can see how the dermis sends these wave-like projections to the epidermis. Those projections are called dermal papillae. And if you take a more closer look, we can see here that in this layer contains 2 main types of structures. One is a blood supply, so this one. This blue-red structure is a capillary bed, so the papillary layer of the dermis has a very rich blood supply. And the other thing that I'm noticing is a nerve supply, so kaning iyang tapad. So a cutaneous sensation, which is also known as a free nerve ending,
this picks up sensation from the skin. And there's actually another type of nerve ending that's not in this picture, and it is called the Meissner's corpuscle, which goes right up here and has a knob-like ending. This nerve structure is specialized in light touch receptions. So based on what I've said, we can conclude that the papillary layer has basically a rich blood supply and a rich nerve supply. Let's look at the reticular portion of the dermis. This layer takes up majority of the dermis, everything between the papillary layer and the hypodermis. And this part here is called the hypodermis. It is the adipose tissue below the reticular layer. And if we look close, we can see that there's a lot there, no? However, these structures that we see are not actually a part of the dermis. For example, we have here a gland, and then a hair follicle, and another gland, and then another gland na pudari, hair follicle, and then gland. And on this side, I can also see a sweat gland. So these glands and hair follicles are just occupying space, if that makes sense. So occupy space lang sila sa dermis and dili jud sila actually tissues of the dermis. These structures derive from the epidermis actually, the hair follicle, the oil and sweat glands. So what we have left is that we can see a lot of blood supply, a nerve supply, and we can also see a specialized type of nerve ending. So just like the papillary layer, ang reticular layer, daghan pud siya og blood supply. So this one, kanang blue and red structures, mga blood supply na sila. And then nerve endings, this one, this is a specialized type of nerve ending called the Pacinian corpuscle. And these are very good at taking up of any kind of vibration or pressure or anything type of sensation that makes it down this deep in the dermis to get picked up by the Pacinian corpuscle. And other than that, you have a lot like during area. Dili kay siya klaro, but there are connective tissues that's making up the reticular layer. That is a dense, irregular connective tissue. So, kani diri nga mga pink part, di ba na ay murag white strokes? Kani siya diri, mga connective tissue na siya dira. So, kanang mga blank space, na murag pink tan-awon, connective tissue na sila, that's connecting all of it together. Dense irregular connective tissue is densely packed with collagen fibers that are running in all different directions. And so the reticular layer of the dermis is extremely strong when stressed in multiple directions. And even though those collagen fibers are running in all different directions, I want you to take a look at this. This is the map of the body that shows you the primary flow of collagen, which is known as the lines of cleavage or the cleavage lines. So, technically, a line of cleavage is just less dense areas between the flow of collagen. And so, the important thing that I want you to remember is that even though these collagen fibers are running in different directions, there is a primary flow that's been mapped out. And the reason why that is important because if an incision or a cut is made against the flow, that injury has more trouble in healing because we can see here on the first circle that it's against the lines of the flow compared to the second circle that the cut is going in line with the lines of cleavage. So mabantayan pud nato na the cut that is in line with the flow is much closed than the ones against the lines. So diba there is a second one, mas dali siya na stitch kaysa sa first circle because the second one is naara siya sa may flow and kato siyang first one is against siya, so mas lisod siya i-heal because gato siya nga part is mao ang wala kaayo mga collagen fibers that helps you to heal the wound faster. Next is stretch marks. Stretch marks happen when the skin is stretched too quickly, causing the underlying dermis to tear. This often occurs during rapid weight gain, pregnancy, puberty, or due to medical conditions and steroid use. Since the dermis contains the skin's elastic and collagen fibers, it plays a key role in how the skin expands and contracts. To understand it better, imagine the dermis as a woven fabric or a balloon. When stretched gently, it returns to shape, diba? But if pulled too fast or too far, the fibers snap or thin out, leaving behind weakened lines just like permanent stretch marks on the skin. These marks begin as red or purple streaks and later turn white or silvery as they scar. In short, stretch marks are the result of dermis tearing under pressure, and though they are harmless, they reflect deeper structural changes to the skin. When we think of the skin, we often focus on the surface, but what lies beneath plays a vital role in keeping our body safe and functioning well. One important layer is the subcutaneous tissue, also known as hypodermis. This is the deepest layer of the skin, and while it's not always talked about as much as dermis or epidermis, it performs essential functions that help protect and support the body. So, the hypodermis is composed of fat cells or adipose tissue, connective tissue, and blood vessels. It serves several key purposes. First, it acts as an insulator, helping regulate and maintain the body's temperature. Second, it works as a cushion, protecting internal organs, muscles, and bones from physical trauma. Third, it serves as a fat storage area, providing energy reserves for the body when needed. Fourth and lastly, it anchors the skin to the underlying muscles and bones, giving the skin stability and structure. To imagine its role, think of the skin as a mattress. The epidermis is the outer fabric, the dermis is the foam, and the subcutaneous tissue is the soft base layer. Just like that padding gives support and softness to the mattress, the hypodermis provides protection, support, and energy to the body. So in summary, the subcutaneous tissue may be hidden, but its role is critical. It doesn't just hold everything together, it protects, supports, and nourishes the body from the inside.
Types of injection and techniques. So there are three main types of injection techniques based on the target tissue. First, we have the intradermal injection. So the target tissue is the dermis, and to perform this, a shallow needle angle is used, inserting the needle into the skin. Example is for tuberculin skin test. Second, we have subcutaneous injection, and the target tissue is the subcutaneous tissue. While the technique to perform this is the skin is pinched into a tent and a short needle is inserted. Example, it is frequently used for insulin injections, like for those who have a diabetes. The third is intramuscular injection. So the target tissue is the deep muscle tissue, and to perform, a long needle is inserted at 90-degree angle. Example, it is used for administering vaccines and antibiotics. Next, we have FAMQ. So the F stands for fibroblast, which are cells that make fibers like collagen and elastic fibers. A is for adipocytes, or fat cells that store energy as fat. M, it means macrophages, which are immune cells that help fight infection. Stands for connective tissue, specifically loose connective tissue that contains both collagen and elastic fibers. Next is U, so it refers to the layer under the skin that connects it to muscles and the bones. B is for blood and nerve supply, which brings oxygen and signals to the skin. Lastly is E. It means this layer also stores energy, provides insulation, and acts as the padding to protect the body. Hair or peely. It is found almost everywhere on the skin except the palms, soles, nipples, parts of the genitals, and the tips of fingers and toes or the distal. Then four, in other mammals, it is a thicker, denser covering of hair. Next, hair development. We have lanugo. This is a soft, unpigmented hair that appears on the fetus around 5 to 6 months of pregnancy. Then, before birth, we have two, which is first terminal hairs that replace lanugo on the scalp, eyebrows, and eyelids. The second is volgus hairs. It is short, fine, and unpigmented. Also, it replaces lanugo on the rest of the body. For the hair changes and puberty, during puberty, terminal hair replaces vellus hair in certain areas. So we have in both males and females, pubic and axillary areas, while in males is on the face, like mustache or the beard. For the body hair differences, the male body hair is about 90% terminal, while in female body hair is about 35% terminal. For the functions of pubic and axillary hair, it indicates sexual maturity, also spread natural body odor from sweat glands, which may act as the signals. And the pubic hair also helps to protect skin during sexual activity, while the axillary hair may help reduces friction from the movement. Next is hair structure. We have three. First is shaft. It is visible part above the skin, then roof. It is part below the skin, and third is the hair bulb, which is base of the roots where the hair starts to grow or where growth starts. And we also have a three hair layers. First is the medulla. So when we say medulla, it is soft and a central core. Then the second is cortex. It is thick middle layer with hard keratin that gives the strength. Lastly is the cuticle. So it is outer protective layer with overlapping cells. For the hair follicle, it is like a tunnel in the skin where the hair grows. Inside it, the internal root holds the hair in place. Then the hair bulb is found at the bottom of the follicle and also it helps make new hair, while the hair papilla has blood vessels that give nutrients for the hair growth. So the hair follicle contains first is the dermal, which comes from the dermis, which is the deeper skin, and it wraps around the epithelial part. Second is the epithelial root. So it comes from the epidermis, and it is a top skin layer and has two parts. So first is the external. It includes all the layers of the skin, which is the strata. Second is internal. So it has a fewer cells and it ends at the hair bulb. Then there are two main stages for the hair growth cycle. First is the growth stage, where the hair gets longer. Second is the resting stage, and the hair stops growing. And it says that hair naturally falls out and it is replaced by a new hair. So the growth time depends on body part. And for the scalp, it grows for about 3 years and rests for 1 to 2 years, while the eyelashes grow for 30 days and rest for 105 days. So, we normally lose about 100 hairs every day. Next, we have the two examples of hair conditions. First, we have alopecia. So, this is a condition where a person suddenly loses hair in patches. But the good thing is, the hair often grows back. It is usually linked to the immune system attacking the hair by mistake. While pattern baldness, this is a permanent type of hair loss, and it happens slowly over time and the hair gets thinner because by genetics like from our family or some hormonal changes. Pattern baldness is common in men, especially as they get older. Next is hair color. So hair color depends on melanin from melanocytes in the hair bulb, and different types and amounts of melanin create various hair colors, which are the blonde, the black, and the red. Then for the erector pili muscle, it is a small muscle attached to the hair follicle and contracts to make hair stand, like a goosebump. Then lastly, we have a reminder here that says hair turns gray or white with age as melanin production decreases. So that's all for the hair.
Glands. Glands are the small organs of the body that make and release substances like sweat, oil, or hormones. And it has different glands that release substances to its surface. The main skin glands are the sebaceous glands, apocrine sweat glands, eccrine sweat glands. Sebaceous glands is found in the dermis, produce sebum, and it keeps skin and hair soft. It also helps prevent bacterial growth and help dehydration. So we have the two types of sweat glands, which is the eccrine sweat glands and apocrine sweat glands. Eccrine sweat glands is widespread, and it helps regulate body temperature via sweat. While the apocrine sweat glands, it is involving in scent or the odor of the body where it's specified. Under the two types of sweat glands is ceruminous glands and mammary glands. Ceruminous glands, it modified eccrine glands in the ear canal where it produces airwax, cerumen along with sebaceous glands. Function of it is protect the eardrum by trapping dirt and insects, while the mammary glands modified apocrine glands in the breast part will it produce milk. So we have here nails. We all know what nails are. It is a hard protective covering made of keratin found in the tips, on the tips of our fingers and toes. We have here the structure and composition of nails. It has 7 parts, which is the nail root, nail body, nail fold, nail groove, cuticle, free edge, and lunula. We have here surrounding structure. Nail fold. Nail fold, skin covering the lateral and proximal edges, and it acts like a border or frame around your nails. While the nail groove help guide the nails as it grows straight. Cuticle and hyponychium. Cuticle, it is extension of stratum corneum from nail fold into the nail body, which protects the new nail from infection. While the hyponychium, it helps protect the nail bed from infection. Nail growth and attachment. The nail root extends from the nail matrix, which lies beneath the skin. The nail root is the starting point of the nail, where nail grows from. Nail bed located between the nail matrix and hyponychium. Both matrix and bed are made of epithelial tissues with a stratum basal. Nail matrix is thicker and produces most of the nail. We have there the appearance and color, which appears pink due to underlying blood vessels, while the nail growth rate, nails grow by sliding over the nail bed toward the fingernail. Lunula. Lunula is a whitish crescent-shaped area that's seen best on the thumb. The average growth is 0.5 to 1.2 millimeter per day. Fingernails grow faster than our toenails. And nails grow continuously and have no resting phase unlike hair. This is the exact picture or the point of view of our nails. The next slide is all about the physiology of the integumentary system. The first one is protection. Protection, it acts as physical barrier against UV rays, pathogens, and physical damages. The second one is sensation. Sensation contains the sensory receptors like touch, pressure, pain, and temperature. The third one is temperature regulation. And temperature regulation, sweat and blood flow that helps maintain our body temperature. The fourth one is vitamin D production. Is a UV light stimulates the skin to produce a precursor of vitamin D. It also triggers the UV exposure, vitamin D production in skin. The fifth one is excretion. Excretion is a small amounts of waste. Products like urea, uric acid, and the ammonia are excreted through sweat. Last but not the least, the immunity. Immunity involves the Langerhans cells in the epidermis, helps to detect invaders.
So now, moving on to the burns. So a burn is an injury to the tissue caused by external factors like heat, cold, friction, chemicals, electricity, and or even radiation. These injuries can damage the skin and, depending on how severe, can affect deeper tissues as well. Burns are usually classified based on two main things: the extent of the surface area involved and the depth of the burn. And we have also the types of burns. We have which is the first degree burns, second degree burns, third degree burns, and the fourth degree burns. Now, let's talk about how burns are classified based on that. Burns are divided into two main categories: partial thickness burns and full thickness burns. Thickness burns include first degree burns and second degree burns. First degree burns, which only affect the epidermis or the outer layer of the skin. A good example is a mild sunburn. And the second degree burns, which damage the both epidermis and the part of the dermis. These usually cause redness, pain, and blisters. On the other hand, we have the full thickness burns. These are the third degree burns and the fourth degree burns. The third degree burns, where the damage goes through the epidermis, dermis, and even the subcutaneous tissue. The fourth degree burns go even deeper, destroying tissues under your skin like muscles or bones. So now, moving on to the types of the burns. First, we have the first degree burns. First degree burns, only the superficial epidermis is damaged. The area becomes red and swollen.
except for the temporary discomfort. First degree burns are not usually serious and generally heal in 2 to 3 days or in a week. Sunburn without blistering is a first degree burn. Now for the degree burns. Second degree burns involve injury to the epidermis and the superficial part of the dermis. The skin is red, painful, and blistered because sufficient number of the epithelial cells are still present. Regrowth of the epithelium can occur. Ordinarily, no permanent scars result if care is taken to prevent infection. Now moving on for the third degree burns, which is full thickness. Third degree burns destroy both the epidermis and the dermis and often extend into the subcutaneous tissue, reflecting their categorization as full thickness burns. Blisters usually present and burn area appears blanched or it is the gray and white or blackened. Because the nerve endings in the area are destroyed, the burn area is not painful. In the third degree burns, regeneration is not possible, and skin grafting must be done to cover the underlying exposed tissues. Lastly, the fourth degree burns. Fourth degree burns are also full thickness burns, but they extend to deeper tissues such as bone, muscle, or tendons. These burns appear dry and leathery, and they require surgery and grafting to the cover to expose tissue. In severe cases, amputation may be required to save the patient's life. Now, let's move on to the effects of burns, which can be divided into local effects and systemic effects. Systemic effect. First, the local effects refers to the direct damage caused by the burning agent like fire, heat, or chemicals, only to the skin area that was exposed. For example, if a hot object touches the arm, the damage is limited to the part of the skin. But burns can also cause systemic effect, which means they affect the entire body, not just the burned area. These effects can be serious and life-threatening. Some systemic effects include fluid and protein loss, bacterial infection, poor blood circulation, low urine output, and a weakened immune response. So even a burn, if a even if a burn seems like just a skin injury, it can actually affect the entire body if it's severe. Next, I'm discussing the unimportant tool used in assessing burn injuries, which we have the rule of nines. It's a quick method used to estimate the total body surface area affected by burns. In adults, the body is divided into sections that presents 9% or multiples of nines. For example, the head and neck is 9%, each arm is 9%, and the front and the back, each leg are 18%, and the front of the torso is 18%, and the back is also 18%. The perineum makes up the remaining 1%. However, in infants and young children, this rule isn't accurate. That's because the head is proportionally larger and the legs are smaller compared to an adult's body. For example, in a 5-year-old child, the head takes up a bigger percentage of the total surface.
Effects of aging in the integumentary system. We have skin thinning and slower repair. As we age, the epidermis becomes thinner and the collagen in the dermis reduces. This leads to skin that is easily damaged, heals slowly, and is more prone to infections. So, if manotice ninyo, our grandparents, madali silang masugatan, even from a small bump, or how a small cut on their arm takes a long time to heal. That is because their skin is thinner and has less collagen to help repair damage. It also makes them more prone to infections. So, look at this picture. It is a picture of an aged skin. If you will notice, it is thin at mas madali siyang masugatan. Next is we have wrinkling and sagging. It is the decreased elastic fibers in the dermis and loss of adipose tissue in the subcutaneous layer cause sagging and wrinkling. So, some creams like Retin A help with shadow wrinkles, especially those from sun exposure. That is why many celebrities or known influencers they use anti-aging creams or they undergo treatments like Botox para ma-reduce ang wrinkles and sagging. Next is we have dryness and temperature regulation. Older adults often have dry skin because their oil glands slow down. They also sweat less and have less blood flow in their skin, which makes it harder for them to cool down. That's why during hot days, elderly people are at high risk for heat exhaustion and death if precautions aren't taken. The next one, we have changes in pigmentation and hair. As we age, our skin and hair change due to a drop in melanin, the pigment that gives color. Melanocytes are cells that give our skin and hair their color. As we get older, we have fewer of them. That's why old people often have gray or white hair. But in some areas like the face or hands, melanocytes increase and form brown spots that we call age spots. The next one is we have sun exposure and accelerated aging. Skin exposed to sunlight ages faster than non-exposed skin. Chronic sun exposure causes normal elastic fibers replaced by a thick interwoven mat, fewer collagen fibers, and impaired keratinocyte division. So, if manood ninyo, how people who are always in the sun sometimes look older kay because the sun damages the fibers that keep the skin tight and smooth. It also breaks down collagen, a protein that keeps our skin firm and slows down the skin's ability to heal. So, if you look closely at these images, especially the comparison of sun exposure of identical twins, the identical twin one had more sun exposure than identical two. So it is really important for us to use sunscreen or wear a hat when it is sunny because too much sun exposure kay makakasira sa collagen at kaya mas mabilis tumanda yung mga balat natin. Kaya if nasa labas, if you're under the sun, it is really important to wear long sleeve or bring umbrella. An example for this is, those people who work under the sun a lot, like our farmers, construction workers, or fishermen. They often look older than their age because too much sunlight damages skin fibers that cause early wrinkles and dark spots if I compare nimo to people who stay indoors or use sunscreen. The next one is the representative diseases and disorders of the integumentary system. So, now let's talk about common skin problems that some are genetic, others are caused by germs or the environment. The first one is the birthmark. It is a congenital disorders of the dermal capillaries. Some people are born with colored spots called birthmarks. This happen when blood vessels in the skin don't form normally. Some babies are born with colored patches like red marks on the forehead or brown spot on the back. The second one is ringworm. It is a fungal infection that produces patchy scaling and inflammatory response in the skin. The third one is eczema or dermatitis. It is an inflammatory condition of the skin caused by allergy, infection, poor circulation, or exposure to chemical or environmental factors. The next one is psoriasis. Psoriasis is a chronic skin condition where the epidermis thickens, especially the stratum corneum layer. This leads to large, silvery scales forming in the skin that if you scrape these scales, bleeding can occur. And the next one is frostbite. Frostbite have 3 stages. The first one is frostnip, which is you will feel cold, sore, and painful. The skin is red and purple. The stage 2 is superficial frostbite. Pins and needles, patches of the peeling skin, and the stage 3 is deep frostbite, numbness, hard, and black skin forms. So, in winter countries, people wear thick jackets, gloves, and boots to prevent frostbite. Next one is we have the bacterial infections. The impetigo, it is a small blisters containing pus, easily ruptured to form a thick yellowish crust, usually affects children. They get it through direct contact, especially when children scratch, insect bites, eczema, or wounds. It is also very common among kids in schools or daycare because if one child has it and scratches the rash, it can easily spread to others, especially if they share toys, towels, or don't wash hands often. The second one is erysipelas. It causes red, swollen hot patches and usually comes with fever. Older adults, especially those with diabetes or poor circulation, are more at risk. That if they get a small cut on the leg or foot, it can lead to this painful red infection with fever. The last one is acne. It is a long-term condition where oil and dead skin black hair follicles causing pimples, blackheads, or scars. So, people get it through hormonal changes, especially during puberty for teenagers. Overproduction of sebum or skin oil, bacteria on the skin, or sometimes poor diet, stress, or genetics. Next one is the viral infections. So we have measles and chickenpox. In measles, you will feel fever, runny nose, sore throat, and red eyes. While in chickenpox, the tiredness of or fatigue, headache, fever, red spots that can first appear on the chest, face, and back, the decrease of appetite, and spots turning into itchy blisters. And we have viral infections, the measles and chickenpox. Measles is also called rubella, a skin lesions caused by a virus contracted through the respiratory tract. It may develop into pneumonia or infect the brain, causing damage. The second one is the chickenpox. It is a skin lesions, usually mild viral disease contracted through the respiratory tract. Next is so these are the other diseases and disorders. We have vitiligo. It is a skin condition where patches of skin lose their color. Second one is alopecia areata. It is an illness where the body attacks its own hair roots, causing hair to fall out in small round patches. It can happen in the scalp, eyebrows, or anywhere that the hair grows. Third one is we have skin cancer. It is a dangerous growth in the skin caused by too much sun or other harmful things. It can look like a new spot, sore, or mole that changes over time. In bacterial infection, we have the bed sores or decubitus ulcers. It is a painful sores that happen when someone lies in one position for too long. It mostly affects people who can't move much, like those patients in bed or wheelchairs. In viral infection, we have German measles, shingles, fever blisters, and genital herpes. In shingles, it is a painful skin rash with blisters caused by the same virus as chickenpox. It can happen in older adults or people with weak immune systems. In cold sores or fever blisters, it is a small, painful blisters that usually appear on or around the lips. They are caused by a virus and can come back again and again. Lastly, the genital herpes. So it is a common virus that causes painful blisters or sores in the private parts. It usually spreads through it spreads through skin to skin contact during sexual intercourse. So, in conclusion, the integumentary system plays a vital role in protecting the body. It regulates temperature, sensing the environment, and understanding its structures, functions, and common disorders helps us appreciate how essential skin health is to overall well-being. By taking proper care of our skin, we can prevent many problems and maintain a healthy, functional